So yeah, my name is Kira Haug. I'm out of Kamloops, BC, and we have another agency in Merritt providing rural outreach for chronic health navigation. Our mission statement, we provide awareness, education, advocacy, and support related to HIV/AIDS, Hep C for marginalized and persons at risk in order to develop healthier communities. In our philosophies, we have two of which, human rights perspective and the housing first model, and our guiding principles, harm reduction, self-determination, social justice, and sustainability. Chronic Health Navigation Project is designed to help individuals who require support linked to the right services and agencies gain access to medical centers and other professionals. We coordinate patient-centered team planning, including advanced care planning for chronic health management, strengthening collaboration and shared care between specialists and family physicians for patients with complex needs, looking at community health care versus emergency service utilage. We work towards improved quality of care for populations who currently experience low health stats or gaps in services and clinical decision-making, which is based on informed patient goals. Our team, there's 4 of us. We are social workers, one of which is also a peer. We have experience and understanding of street entrenchment, rural communities, Indigenous and cultural sensitivity, harm reduction, addiction, mental health, and equity of service in relation to chronic healthcare support services. Our catchment is a regional service area, including Aboriginal communities and smaller towns and cities in the BC interior. Why housing first? Life on the streets and in shelters creates cascading trauma that can lead to addiction, abuse, and suicide. Organizations that work with the homeless have the best results when they provide a continuum of care, including outreach, housing, healthcare, employment, education opportunities. And a housing first approach has been producing really successful outcomes for those involved with Ask Wellness. Clients in the Health Navigation Program currently have reported greater quality of life, socialization, mobility will actually drive folks to St. Paul's Hospital and attend all appointments with them. Community awareness and engagement, better sense of self, awareness of their own chronic health issue and management, and a reduction in emergency services. Based on questionnaires we issued, we found these groups to be our target populations: Aboriginal people, immigrants and refugees, ethno-cultural minorities, children and youth, older adults, women in marginalized or compromised situations, the GLBTQ community, persons with low levels of literacy or education, and homeless people, including both visible and hidden. They identified the following issues as things that they deal with. We have persons with disabilities, persons with neurological disorders, mental health and addiction problems, persons with elevated susceptibility to infectious disease, and persons with acute or chronic conditions. And with these conditions, they've experienced these gaps in service: inequity of professional and medical services, transportation barriers, isolation, stigma and discrimination, financial distress, appropriate housing, and opportunities for education and employment. This is our health navigation model. First, we look at stability in housing by engaging landlords. We work closely with about 80 landlords between Kamloops and Merritt, and we have it now set up so that landlords will actually connect with us or refer a client to us, a tenant to them, for our health navigation if they think we can assist. And then we streamline the client's case management into either HIV or Hep C case management or other chronic illness, and most often we're dealing with both. The next thing is to do the wraparound with services and supports for that individual. So according to StatsCan, 1 in 3 Canadians report they have at least one chronic healthcare issue, and more than 1/3 of this group reports multiple long-term health problems. And although our focus is on HIV and Hep C support, we will support anybody that walks in the door. We believe that nobody gets left behind, and so we're seeing a combination or one of the following issues for our clients: HIV/AIDS, Hep C, mental health, addiction, COPD, diabetes, Parkinson's, multiple forms of cancer, lupus, dementia, and Alzheimer's. Navigators built linkages between patients and services, advocating for provincial and federal health benefits. We find appropriate housing and nutritional resources, provide access to mental health, medical, dental appointments, social and medical supports, group agency resources to maximize health treatment outcomes. Assistance in obtaining appropriate referrals to specialists for in-depth diagnosis and best possible medical care, providing needle exchange and harm reduction supplies to cities and rural areas alike. We also provide educational resources and workshops on HIV, Hep C, STI prevention and education with the Traveling Safer Sex Lady program, which is a program I deliver as well. Thank you for the 5 minutes. For more information on, nailed it. For more information on chronic health navigation services or the Traveling Safer Sex Lady, aka me, you can contact us at askwellness.ca, or I have my contact information there. Thank you so much for including us in the Katie Forum on behalf of Kamloops and Merritt.